All right, so we are discussing chapter 20 in the Pharmacy Technician Principles in Practice, 5th edition book. Chapter 20 goes over the therapeutic agents for the cardiovascular system. In this particular lecture, we will be going over the following objectives, and some of those objectives include you being able to describe the major components of the cardiovascular system. By the end of this presentation, you should be able to list the primary symptoms of conditions associated with the dysfunction of the cardiovascular system. You should also be able to recognize drugs that's used in the treatment of the conditions that's associated with the cardiovascular system. You should also be able to write the generic and trade names for the drugs that's discussed in this chapter, as well as list the appropriate auxiliary labels when filling prescriptions for the we'll be discussing in this chapter. The vascular system is heart is located in the large muscle that indicates a systemic arterial pulse waves. It also causes blood to circulate throughout the entire body, which is why it's called the cardiovascular system, because it's not just operating just in the heart, but there is a blood flow that's happening throughout the entire body. The heart also supplies the body with nutrients as well as oxygen. And so you might be thinking, what are the three types of muscles in the body? So if you're taking notes, this is important to understand. The three types of muscles in the body include smooth muscles, skeletal muscles, and the cardiac muscle. So what type of muscle is found in the heart? Well, the heart is composed of the cardiac muscle, which is like a skeletal muscle, but it has involuntary control, like a smooth muscle. So there are three types of muscles in the body. Again, that's smooth, skeletal, and cardiac. And when it pertains to the heart is composed of the cardiac muscle. So now that we've gone into a little bit of how the heart is a certain type of muscle, we'll continue learning about the anatomy and the location of the heart. So inside of the heart, it also has some arteries that are large, and it transports tubes that extends from the heart. You also have the arterioles, which are smaller tubes, and then you have some capillaries, which are very small tubules that exchange oxygen and nutrients. And so with the heart, it's located between the lungs, in front of the vertebral column, and then also behind the sternum. And so as we continue learning about the cardiovascular system, we're going to get into what the heart does. So with the heart, there is a normal heartbeat. So the normal heartbeat is about 60 to 100 beats per minute. Uh, when it comes to understanding uh, the different types of layers that the heart has, it has an endocardium, a myocardium, and an epicardium. So understanding medical terminology, anytime you see the word peri, P-E-R-I, that represents around or enclosing. Anytime you see cardi, C-A-R-D-I, that represents heart in medical terms. So the pericardium is the connective tissue that surrounds the heart and is anchored by ligaments to the chest wall and the diaphragm. And so in understanding the heart, it has three main layers. Again, the endocardium, the myocardium, and the epicardium. So with the endocardium, that's the inner layer. And so the endocardium has a smooth accordion-like, pleat-like surface, which allows the heart wall to collapse when it contracts. Now, the myocardium is the middle muscular layer, and the myocardium is the heart muscle that contracts to facilitate a heartbeat. Now, the epicardium is the outer layer, and the epicardium is the outer heart wall layer. So the coronary arteries that supply the heart with oxygenated blood and the coronary veins that return deoxygenated blood to the heart are in the epicardium. And as we continue in this chapter, we'll go over how the oxygen goes inside of the lungs and how that actually operates. So the size of the heart is about the size of a person's fist. And if you've ever watched one of my favorite movies when it comes to medical, it's called John Q with Denzel Washington. It kind of gives you a real in-close look of what kind of like the heart looks like. And then you'll see, I'm not going to tell the movie, but it's a really good, I like to think, simulation, even though it's actors portraying. It's a really good look to see what the heart looks like. So in learning about the heart, we're going to next learn about oxygenation. And so the heart has two pumps, and it also has two chambers. So in the two chambers, you have the right atrium and the right ventricle. So with the blood, it circulates through the body by exchanging oxygen, nutrients, tissues, and then the blood circulates through the organs and the tissues. Inside of the process, when it superior and the inferior turns the blood to the heart. Now, the superior vena cava brings the blood from the upper portion of the body, and then the inferior vena cava brings the blood into the heart from a lower portion of the body. So you might be thinking, why, when we see a heart, it's let me see if I can draw it a little bit. When we actually see a heart, I hope it lets me do this. Nope, wrong one. When we see a heart, the shape of a heart, if you were to draw one, I'm going to show you, here's a great example. So when we have a heart, you have the atriums, which represents the top part, and then the ventricles, which represent the bottom part. So the reason why it's drawn as a heart like this, I wish there was a squiggly that let me draw on top of this. I'm trying to figure it out, you guys. Hold on. So I'll go like this. So let's pretend if this would let me draw on it. It's not, but in a better world, it would let me be great. So the reason why they draw the heart like this is so you can remember you have the left atrium and the right atrium, and then on the bottom you'll have the left ventricle and the right ventricle. I remember that the ventricles are on the bottom based on how this heart is shaped. And so when you think of V goes downwards. And so that's how I remember that the ventricles are at the bottom. It'll make sense when I show you a video, but just kind of wanted to go over that. So there are some other sources when it comes to oxygenation, and that includes with the blood. The blood travels through the right atrium to the right ventricle, and then from the right ventricle contracts and it sends the blood to the pulmonary arteries, and then it goes to the lungs where the blood is then oxygenated. So the left atrium receives the oxygenated blood from the lungs through the pulmonary veins. And then it's the left ventricle that when it contracts, the blood is being sent to the aorta. So once again, the cardiovascular system is also unique with the respiratory system because you have pulmonary veins that carry oxygenated blood, whereas there are veins in other parts of the body that carry deoxygenated blood. And again, this is just the lecture form to it, but I will be sharing with you guys a video to understand it better. And then you may also see inside of your books pictures of the heart and how how the deoxygenated blood flows through and how the oxygenated blood flows through the cardiovascular system. So in continuing learning more information about the cardiovascular system, we are next going to talk about the cardiac conduction system. So with the cardiac conduction system, it's a system that provides the electrical charge that makes the heart pump. And so it's basically ran by two nodes. That's the sinoatrial, which is abbreviated as SA, and the atrioventricular, which is abbreviated as AV. So what does the sinoatrial nodes do? Well, in the upper right atrium wall, it sends the signals to the atrioventricular node and a septum between the right atrium and the right ventricle. Then it goes throughout the mucous fibers. So in understanding the cardiac conduction system, we'll next continue to learn about the cardiac cycle. So the cardiac cycle is a series of events that can occur for one complete heartbeat. And so there are basically two sequences. You have the systole and the diastole. If you ever had your heartbeat checked to see, what your blood pressure is, you'll hear the term systolic over diastolic. So it's important to know what the two does. If you are writing notes, this is important information. The systole is the contraction phase, whereas when after the heart contracts, so this blood from the heart chamber into the pulmonary artery or the aorta, and in diastole, the blood refills the chambers, basically meaning it relaxes. And during diastole, the atria contracts to pack 20% more of blood into the ventricles. So most of the body's blood supply is actually cycled every minute through the heart. So in continuing learning about the cardiovascular system, we'll learn about there is some regulation of the heart and understanding about the parasympathetic and sympathetic branches of the autonomic nervous system that has opposite effects on the heart rate. And so you may have been familiar with the term epinephrine or norepinephrine. These are released during exercise, which increases the heart rate. And so with blood pressure, those force exerted by blood against the inner blood vessel walls. And then you have a terminology called cardiac output, and that increase means increased blood pressure and flow. And so in this chapter, the primary things that you are going to learn as pharmacy technician students is the medications that also help the cardiovascular system, and if patients have high blood pressure or if they have arrhythmias or hypotension, which is low blood pressure, or if they have hyperlipidemia, which is a high increase of the cholesterol. And so we'll continue talking about some common medications that's used in the cardiovascular system. So some of the common medication classes that's used to treat cardiac conditions, always remember anytime you hear cardiac, anything that ends in AC as a medical suffix, it represents pertaining to. So we know that cardi represents heart and AC represents pertaining to. So cardiac means pertaining to the heart. So we're going to learn about some medications that's used to treat cardiac conditions. So some of the ways how you can remember the drug classifications that treat the cardiac conditions is A, B, C, and D. So this is an acronym. So A would stand for angiotensin converting enzyme. So you have ACE inhibitors. Those are going to help with people who have cardiac conditions. Another drug class would be beta blockers. The next drug class would be calcium channel blockers, which is abbreviated as CCBs. And then the last class that would help with cardiac conditions would be diuretics, which is which is a medical term for a water pill. And there are different types of diuretics, but we'll get into that. So remember, the acronym ABCD when it comes to cardiac conditions is angiotensin converting enzyme, which stands for ACE inhibitors. You have beta blockers, you have and then so basically there are groups of drugs that are used to treat heart conditions. And one major thing to understand when it comes to medications that's treating the heart, they can be used separately or they can be used in conjunction with one or more drugs from another group. So we'll get into some of the examples as we continue. So an ACE inhibitor, remember, angiotensin converting enzyme. The ACE inhibitor works by reducing blood pressure by dilating the arteries. So when it comes to knowing which medication belongs to the ACE inhibitors family, like I mentioned before, anytime you think of a medication class, that medication class has a family. And so with this one, medications that are ACE inhibitors are going to end in the word pril. So an example of pril would be enalapril, lisinopril, captopril. All of these are some examples of the medications that would be an angiotensin converting enzyme. And so that way, as a pharmacy technician, when you see the generic name, you'll kind of remember and you'll know what drug class that belongs to. Now, another drug class of heart conditions is the ARBs, which stands for angiotensin 2 receptor blockers. And so with the angiotensin receptor blockers, these are similar to an ACE inhibitor. However, they work by inhibiting the angiotensin, which is going to work by reducing the blood pressure. Now, with angiotensin receptor blockers, those ends in artin. So an example of a drug that's an angiotensin receptor blocker would be valsartan, telmisartan, olmesartan. These are generic drugs that I'm naming, but just giving you some examples. Losartan, valsartan, telmisartan. I always remember that one because I think of tell me something, so I say telmisartan. When you get used to learning the medication names, you'll figure out a way how to remember them. But anything that ends in artan, A-R-T-A-N, belongs to the angiotensin receptor blocker family. And so you're learning suffixes, and basically these are stems, the stem of the word. So if it's at the end, it's going to belong to a class of medication. So far we've learned about ACE inhibitors, we've learned about ARBs, ARBs, angiotensin receptor blockers. Next, we're going to learn about beta blockers. Now, work by blocking the north, reduce the heart rate. But if a person the heart rate. So with medications that are beta blockers, those are going to end in olol. An example of an olol medication would be atenolol, propranolol, Inderol. Thinking off of the top of my head. So I said atenolol, carvedilol, all of the laws. So you can think of laugh out loud. If you laugh out loud, that's going to increase your heart rate. However, we want to decrease the heart rate if the person has high blood pressure. However, you're going to remember it, but that's one way how I remember the OL. So those are beta blockers. Now, calcium channel blockers, that's abbreviated as CCBs. Those work by reducing the calcium intake of the heart, which is going to work by decreasing the blood pressure due to vasodilation. So examples of calcium channel blockers, some of them end in the word pine, or should I say pine, P-I-N-E. So an example of a calcium channel blocker would be amlodipine or nifedipine, just giving those as examples. Now, it's important to understand when it comes to medical terminology the medical words when it comes to heart conditions. So two of the heart conditions could be tachycardia or bradycardia. Tachycardia means fast heart rate. So how I remember tachycardia is fast heart rate. I think of it as if you hurry up and get dressed, you're going to look tacky. But if you take your time, you're going to look decent. I don't know, but tacky, you was rushing too fast. So I think of tachycardia as fast heart rate. Bradycardia is slow heart rate. So how do I remember bradycardia is slow heart rate? I think of the Brady Bunch, and the song is a little bit slow. How it kind of begins. There's a story of a lovely lady. Okay, I'm not gonna sing, but y'all get what I'm saying. Bradycardia, slow heart rate. You're going to be able to remember what these mean based on your experiences and based on what you can match it with. But that's how I remember the difference between bradycardia and tachycardia. So as we continue learning more about the cardiovascular system, let's talk about some conditions that affect the cardiovascular system. So when we think of heart conditions, we should also think of hyperlipidemia, which represents high lipids, which in another word would be high cholesterol. You have heart conditions like hypertension. Hypertension is the medical term for high blood pressure. It's important to understand the abbreviation for hypertension is HTN. You also have the medical term myocardial infarction, MI. That is the medical term for a heart attack. So myocardial infarction is the medical term for heart attack. You also have conditions where people might be at a pre-hypertensive state. That means they are basically borderline. They're in the range of almost having high blood pressure. They're in the range of almost having hypertension. So that's that means before. So pre-hypertensive state. And then you have thrombosis, and thrombosis is going to represent blood clotting. So these are some conditions that affect the cardiovascular system. Hyperlipidemia, hypertension, myocardial infarction, pre-hypertensive state, and then thrombosis. So in learning about the conditions that affect the cardiovascular system, we'll take a further look into hypertension. Now, hypertension is where the person is experiencing persistent high blood pressure. You do have some times where a patient might go to a doctor's office and, they have what's called white coat syndrome, where as soon as they go into the doctor's office, their blood pressure might spike up because they're nervous, or, they don't know what type of diagnosis they might get. They just, their nerves, their anxieties might be kind of up. So that's why sometimes when people go to the doctor's office, they'll, have them sit for a moment so that they can calm down, and then they'll take their blood pressure. And then, when they come to their next visit, if you've ever gone to the doctor's office or had a loved one go, they always take those vital signs so that they can get a reading. So even in pharmacies, in a community setting, or in even other settings, they'll have like a blood pressure machine where the person should consistently always monitor what their blood pressure numbers are, so that they can also report these numbers to their physician, so that the doctor can also know time what the person's blood pressure is. Hypertension is persistent high blood pressure. That means every time it gets checked, it's always high. Now, it's important to understand hypertension is better known as the silent killer. This is because there are no obvious signs of its presence, so it can just sneak up on somebody. So it's the result of various factors such as diseased heart, or maybe their kidneys are not working properly, which can also cause edema. And edema is a medical word for swelling, excessive swelling. So there are some risk factors in a person that might have hypertension. Important to know, some of the risk factors of hypertension include genetics, a person's age, their gender, their race, their lifestyle, their diet, their anxiety, their alcohol consumption, or their sodium intake. All of these are risk factors when it comes to a person having hypertension. So it's important to know the risk factors so that when you are speaking with patients, they might give you some additional information into what they're going through. And this could be helpful so that you can share this information with the pharmacist. So in learning about hypertension, we'll also learn that with hypertension, high blood pressure is where the systolic is more than 140. And then how is it read? That's where the diastolic readings have 3 categories of hypertension, and the systolic has at least 2 categories of hypertension. So there is a 4-step approach based on the severity of the condition. And when a person has hypertension, they can either diet with or without medication. And these are some leading contributors of hypertension, which include food that's high in fat, sodium, and tyramine. So a person's diet might consist of them staying away from fried foods, because that's gonna, make the body work a little more harder in order to get those food nutrients in. And then some ways to reduce hypertension would include reducing salt, because too much sodium is too much salt. So ways to reduce hypertension would be to reduce salt, to reduce their alcohol intake, to exercise, and to also quit smoking if they are smoking. So what is the technical term when it comes to what type of foods contain high levels of tyramine? Some examples are aged or fermented foods such as cheese, beer, and wine. Those contain high levels of tyramine. And then there are some other foods that contain tyramine, which includes raisins, bananas, and avocados. And I don't know about you, but I love me some avocados. So now that we've talked about hypertension and what it means, let's next learn about some treatment when it comes to how can this condition be treated. So there are some main agents that can help treat hypertension, and those can be some antihypertensives. Anytime you hear the word anti, that means against. So it's going to be something that's going to work against the high blood pressure. So some would be levodopa, doxazosin, clonidine, terazosin, and prazosin. Some other agents include diuretics or vasodilators. And if some medication is required, there is going to be some diuretics. That's the initial drug therapy. Some other agents, if a person has been diagnosed with hypertension, would include ACE inhibitors, beta blockers, as well as calcium channel blockers. So you keep hearing me talk about hypertension. How do we know the difference between high blood pressure and low blood pressure? Well, anytime you see the word hyper, Hyper, that means high. Tension is another word for tension is pressure. So hypertension means high pressure, so high blood pressure. Hypotension, Hypo, means low blood pressure. So there are some conditions where people may experience standing up too quickly from a lying position. This would be considered orthostatic hypotension. Remember, hypotension means low blood pressure, and hypertension means high blood pressure. So there are some side effects of hypotension that includes fainting or dizziness. Another term for dizziness would be vertigo. Now, there is some treatment when it comes to hypotension, and that's going to include them adjusting their medications, increasing their salt intake. They should be drinking more water, and then they should also be mindful to move and stand slowly and not to just stand up too quickly, because that could cause hypotension. There is some drug treatment that's going to help increase the blood volume or raise the blood pressure. Examples of that would be fludrocortisone and midodrine. These are some examples. Now, hypotension can also be caused by a number of diseases and conditions. Some examples of those would include pregnancy, dehydration, and the Addison disease, which is an adrenal insufficiency. These are some examples of hypotension. So now that we've learned the differences between hypotension and hypertension, let's next learn about another cardiac condition, which includes hyperlipidemia. So hyperlipidemia means it's an increase in lipids in the bloodstream. So this could be caused by high cholesterol. So when it is uh, increased lipids, that means there's going to be a precursor to atherosclerosis. Now, you might be thinking, well, I thought cholesterol is okay. Well, there's different reasons, but the main purpose of cholesterol is it's vital for making steroid hormones and cell membranes. But there's a such thing as good fats and bad fats, and we'll talk about the differences. So when we eat and ingest foods that are high in fat, that can cause too much cholesterol, and if it sits in our bodies, it's going to clog our arteries, and our bodies can't eliminate it. So we have foods that contribute to our LDL and our in our cholesterol levels. So an example of the LDL would mean low density lipoprotein. And so these are foods that contain high levels of saturated fat and trans fat, which is another example of trans fatty acids. And these contribute to high cholesterol. And so some examples of foods that cause high cholesterol would be, like eating fast food, eating margarine, eating commercial goods, even float through the bloodstream, and they basically latch onto large arteries as well as middle-sized arteries of the heart and brain, and our bodies really can't eliminate it. So when it comes to cholesterol levels, people can be tested for it, and a person, when the cholesterol levels are checked, if their cholesterol is less than 200, then that means they're okay. Their cholesterol levels is okay, but if they're borderline, that's going to be anywhere between 200 and 239, and anything that's over that would be that person having hyperlipidemia. So recent research has shown that the ratio of the types of cholesterol is more important than the total cholesterol intake. And when they check their cholesterol, they also continue to either have the patient make some modifications in their diet, how they're eating, exercise, or if it's really out of hand, the physician might prescribe medication. And so with hyperlipidemia, that's where their cholesterol levels would be higher than 240. And then you have an in-depth look where you have the LDL and the HDL. LDL standing for low density lipoprotein, and HDL standing for high density lipoprotein. And so with the cholesterol, this can lead up to the body fat buildup. And so in addition to a diet, hyperlipidemia is also an inherited condition. So it is also known as the most widespread genetically associated disorder. And then there are some blood tests, again, the cholesterol levels. And so when it comes to good cholesterol, that's considered the HDL because it's high density in the lipoprotein. And with the HDLs, it has a function to remove the cholesterol from the arteries, and then it can transport it to the liver. So this is just some example of when it comes to hyperlipidemia. So now that we've learned about hyperlipidemia and what are some causes of it, as well as what are the numbers, let's next learn about some treatment to hyperlipidemia. So I talked about some things that causes it. So some examples in regards to some factors that influence hyperlipidemia includes family history, lifestyle habits, and then even a patient's personal medical history. Now, good cholesterol, again, is considered HDL because they transport the fat from the tissue. Now, with bad cholesterol, that's known as the LDL, that carries around lipids that are known as, it carries around the fat, and those fats attach to the artery walls, which can cause atherosclerosis. So too much cholesterol in the bloodstream that's not carried to the liver will lodge in the arteries and cause atherosclerosis. So you keep hearing me talk about atherosclerosis. So to get a better example of what that actually means, atherosclerosis is a condition that's categorized by thickening or a loss of elasticity, also known as hardening, and it also has calcification of the arterial walls. So it's going to be very hard for the blood to flow through the arteries if they're clogged. So that's why cholesterol is very important to pay attention to, because if your arteries are clogged, then it's going to have some major problems. So some medications that can help treat hyperlipidemia, those would be called anti-hyperlipidemics. And so some of the medications will be bile acid quadrants. You also have HMG CoA. Even though it's abbreviated, most of those drugs, that's the anti-hyperlipidemics, include statins. So anything that ends in statin, common drugs that end in statin, an example of that would be simvastatin, rosuvastatin, pravastatin. These are just some examples of the HMG CoA. So HMG CoA is abbreviated for something. The very long word that you see, let's try pronouncing: hydroxymethylglutarate coenzyme A. That's abbreviated for. So statins raise the high density lipids and also lowers the low density lipids in the VLDL. Now, another medicine that could be used in the treatment of hyperlipidemias would be niacin. It's another drug that's added to the therapy. And these drugs work by inhibiting the enzyme that converts the fat into cholesterol. So we're learning about different conditions of the heart. We learned about hypertension. We learned about hypotension. We learned about hyperlipidemia. Next, we're going to learn about coronary artery disease. The abbreviation of coronary artery disease is CAD, and this is associated with atherosclerosis as well as a buildup of lipids, which is known as cholesterol, and that happens in the arteries. Now, if a person is experiencing atherosclerosis, that could be linked to high blood pressure. Now, you have fatty deposits that build up, and then thrombus forms. Remember, anytime you hear thrombus, you should think of clotting. And an artery can be blocked, and this can result in myocardial infarction, which again is another name for heart attack. So some of the medications that would help treat the coronary artery disease would include nitrates. An example of a nitrate is nitroglycerin, beta blockers, calcium channel blockers, and then you also have some bile acid secondants. And so inside, when it comes to the coronary artery disease, there are various risk factors, and those risk factors include hypertension, age, gender, race, genetics, as well as some factor alterations such as a person having fatty diet, no exercise, if they smoke, and then also if they experience a whole lot of stress. So in recent studies have shown an association between gum disease and heart disease, and it's not yet known whether there is a cause and effect relationship between these two. But one study even showed that patients with gum disease had almost twice the incidence of coronary artery disease as patients without gum disease. So we're learning about the conditions of the heart. So again, we learned about hypertension, hypotension, hyperlipidemia, coronary artery disease. Next, we're going to learn about the angina pectoris. So with angina pectoris, there are three types. You have the classic, the variant, and the unstable. Now, classic angina, you should know anytime you hear angina, it basically means chest pain. So with classic angina, it's a short ischemic episode of pain and mild deficiency of oxygen. So when you hear ischemic, what does ischemic mean? Ischemic means it's due to deficient blood supply, not enough. Now, with the pain, a person having some angina pectoris would experience pain in either their chest, their neck, their arms, their teeth, or their jaw. And this can occur after exercise or after some excessive activity. There's also, when a person experiences angina pectoris, there's going to be a decreased blood flow to the heart that results in chest pain, and that can range anywhere from minor to severe. So with episodes of classic angina, it might feel like indigestion, and they usually last less than 5 minutes, and this can include hardening of the arteries, a person experiencing hypertension or cigarette smoking, diabetes, or some environmental and genetic influences. So these are some episodes of the angina. So the most common type of angina is the classic angina. So in continuing about angina, spasms of the artery, and this can be very painful, and it can also occur even at rest. So someone could be either sleeping or, maybe just waking up from a nap, and that's something that could happen. Now, with unstable angina, that's a person who's experiencing a history of anginal attacks. And if a person continues to have that, obstruction of the arteries can increase over time. And although variant angina is rare, it usually occurs late at night or in the early morning hours. So episodes of unstable angina are also most common at night, and they might last as long as 30 minutes and could signal an impending heart attack. So it's also important to know anytime you're speaking to a patient and they complain, that their arms are hurting and they might not know why. As pharmacy technicians, we can always probe and ask questions, but based on their responses, it's always important to notify our pharmacist of the conditions that the patient is experiencing. Also, if a patient calls the pharmacy, and some people do, I've been there, if a patient calls the pharmacy and they have expressed to you that they're having a medical emergency, encourage them to call 911. Sometimes when people are panicking, I've seen it time and time again. Some people just call a pharmacy or they'll call a family member, and it's always encourage them to call the hospital, like call 911 to seek medical attention. So when it comes to angina pectoris, let's learn about some of the treatment that could assist. So some of the treatment would include nitrates. An example of a nitrate would be nitroglycerin. And nitroglycerin comes in various forms. They have a nitroglycerin patch. They have nitroglycerin tablets. And with the nitroglycerin tablets, those are something that can be taken under the tongue, which means sublingual. That way, automatically Angina pectoris would include lifestyle changes, and then if it continues to happen, the person might have surgery to bypass blockage. Now, a person who quits smoking reduces his or her risk of a heart attack by 50% after 1 year. And after 5 years, the risk of heart attack is similar to that of a person who has never smoked. So the earlier in life a person quits smoking, the lower the risk factors of experiencing angina pectoris or other heart conditions. Now, with the drug treatment for angina pectoris, you have some common agents, which include nitrates, calcium channel blockers, as well as beta blockers. However, the most commonly prescribed is going to be the nitroglycerin sublingual tablets, and I kind of gave an example of that. There are some dosage forms of nitroglycerin, which include capsules, topical patches. They even have a nitroglycerin paste, and then they even have a sublingual spray, and that's something where you would spray it under the tongue. Now, the sublingual tablets in injectable forms are used in emergency only. So there are some patients, if they've ever experienced a heart attack, the physician might prescribe for them to have nitroglycerin tablets on them at all times. That way, in the event if they experience another heart attack, they can take the nitroglycerin immediately, and it would help. So nitroglycerin is provided in a glass container, and this protects it from dehydration by light. So in our classroom, we also have an example of nitroglycerin tablets. So remember, it's not real, it's just simulated. So with nitrates, how do they work? They work by reducing the workload of the heart. And so with the sublingual tablets, those are very effective and they offer rapid absorption. And because it's something that's going to be taken sublingually, it's going to bypass the GI system, GI standing for gastrointestinal system, and it's going to enter into the bloodstream directly. Now, when a person takes the sublingual tablet, the drug is not inactivated by stomach acid. Therefore, it creates a faster onset of action. So the nitroglycerin is going to work quickly if it's absorbed sublingually. So now that I've gone over some of the treatment for the angina, we're next going to learn about thrombotic events. So when you hear of thrombotic, thrombosis, that's basically a formation of a clot that's blocking blood flow. That's known as thrombosis. So you have some clots that are really bad, and that's an overactive clotting mechanism. You have an embolus, that's where a clot is broken away from the thrombus and is large and creates blockage. Now, some treatment of thrombosis would include some supportive stockings. This is so using this as an example, support stockings is going to help with circulation. This who do regular, or if they do some regular walking, this is really going to facilitate circulation. You can find some support stockings in a they have some in some pharmacies or in some medical medical supply shop. Some other drug treatments for a person who experiences thrombosis would be for them to take anticoagulants or thrombolytics. And so an example of an anticoagulant would be like warfarin, and that's going to help by thinning the blood so that it doesn't clot. And warfarin interferes with vitamin K synthesis. So with coagulation means blood clotting, and coagulation is a normal body function that's aimed at stopping hemorrhaging, and it starts the healing process. Now, what's important when you hear of thrombosis is understanding what DVT is. DVT stands for deep vein thrombosis, and that happens around the knees. And so there are some medications that would assist with that. One example would be Xarelto. You may have heard of that or seen a commercial on TV. And so the sooner treatment begins, treatment must begin soon after a clot occurs and before the affected organ or tissue is damaged, such as a brain in the case of a stroke. So anytime you hear the term a person has had a stroke, that means they have had a blood clot to the brain. And anytime you hear of a person experiencing a heart attack, that means they've had a blood clot to the heart. So there is a difference between a stroke and a heart attack. So in learning about the heart attack, remember myocardial infarction is the medical term for a heart attack, and a stroke would be like a transient ischemic. So with heart attacks and strokes, the blood flow is entirely blocked because of clotting, and this could result in death of that part of the heart. And so a massive infarction permanently weakens the heart. And so with treatment, they may have cardiac rehab, make some dietary changes, have some beta blockers and some ACE inhibitors. And with a stroke, TIA stands for transient ischemic attack. It could be a short period of reduced oxygenation to the brain, and this can last a few minutes or occur throughout the day. There is some treatment, the things that could reduce some risk factors like antiplatelet medication. These are going to be things that's going to work against the plates in the blood being large. You have anticoagulants, which is going to help by thinning the blood, or even surgery. And so we learned about a few different heart conditions: hypotension, hypertension, coronary artery disease, hyperlipidemia. We learned about angina. We learned about heart attack and stroke. And next, we're going to learn about arrhythmias. So it's regular person has an arrhythmia. If they continue having an irregular heartbeat, they might have a pacemaker, which is going to help with the sinoatrial node. And so with arrhythmias, there is a chemical or oxygen imbalance, which influences a pacemaker, which results in dysrhythmias. And so for short-term treatment, a person may go to the emergency room. And for long-term treatment, something that's going to continue to happen, they might be given medications. So how do artificial pacemakers actually work? It's an artificial pacemaker which provides an electric pulse to the heart when the heart falls below a minimum rate, or if it begins to beat erratically. So this pulse causes the heart to contract. Now with pacemakers, they can be implemented just beneath the skin of the chest, and they have electrodes that run to either the upper and lower chambers or just the upper chamber of the heart. So there are some drug treatments when it comes to arrhythmias, and some of the agents work on a conduction system to induce regular heartbeats. A person might also be given lidocaine, which is used in emergency situations after a myocardial infarction or some other conditions. Some other drug treatments that might help would be quinidine sulfate, or procainamide, and this works by decreasing the speed of the conduction system that's used for tachycardias or other arrhythmias. And so many of the drugs are available in a pre-filled syringe that can be found in a crash or an emergency cart. An emergency cart might be in the ambulance or in the operating room or in the hospital setting. So that's just some examples. Now with dysrhythmias, if there is an imbalance that results from chemicals or oxygen deprivation, a dysrhythmia can also be known as irregular heartbeat, and it also depends on the severity, whether it's something that's going to happen once, like an acute care, or it might not even be required, depending on the severity. Now, some patients may require chronic use, chronic meaning long term. Some patients may require chronic use of medications to help them maintain the heart's normal rhythm. And then when it comes to heart failure, HF, heart failure is a progressive disease, and unfortunately, there is no cure. So there are some symptoms that can be treated, but again, heart failure is not cured. And so when it comes to heart failure, that's where the heart cannot pump vigorously and it delivers less blood throughout the body. And there is some complications such as edema, like where the kidneys would retain more fluid. And so this makes it harder for the heart to work. And the most common treatments of a person who's suffering from heart failure would be some cardiac glycosides like digoxin, or a person might be taking diuretics for edema. Diuretics, again, is another term for a water pill. So if the kidneys retain more fluid, and that's going to cause swelling, they might be given a diuretic, which is going to have them release the fluid, so that it's not building up and being retained. So there are different types of diuretics when it comes to medications, and some examples of diuretics that's used for heart failure in relation to edema would include thiazides. An example of a thiazide would be hydrochlorothiazide, which is abbreviated as HCTZ. You have examples like loop diuretics. An example of a loop diuretic, if I'm not mistaken, is Lasix, which its generic is furosemide. And then you have large potassium sparing diuretics. An example of a potassium sparing diuretic would be a medication like spironolactone, just using that as an example. Now with thiazides and loop diuretics, you have where they're going to lose large potassium in their urine. So therefore, if a person is on a diuretic, they might be prescribed a potassium pill. So diuretics can be given with agents to decrease the effects of sodium retention. So sodium, too much sodium in the body means too much salt is in the body. And so if the prescriber prescribes them to have a potassium sparing diuretic, an example of that would be triamterene in a combination with hydrochlorothiazide. So some of the medications we've learned this hour were hypertension medications, for medications that's going to reduce the high blood pressure. Examples of those classes would be A, B, C, and D. A meaning the ACE inhibitors, B for beta blockers, C for calcium channel blockers, and D for diuretics. We learned about medications that's going to be helped with hypotension. We learned about medications that help with angina, such as nitroglycerin. We've also learned about medications that help with diuretics. And we've also learned about other heart conditions like hyperlipidemia, representing the high lipids. And then we've also talked about arrhythmias and myocardial infarctions, which is another word for a heart attack. So in learning about the cardiovascular system, we've learned a few different ways of how the system works, and understanding that the heart goes through a lot. And so if a patient has one of those risk factors, such as their age, their gender, their race, or even their lifestyle changes, how they're eating, that can all affect their health. And this is actually going to complete chapter 20. as we learned about therapeutics for the cardiovascular system.